Parth, can you please play audio of Gunaisha? So we'll play one audio followed by two videos.
Hello everyone. My child Gunaisha Mendiratta was born on 11th April 2018. Due to stopped fetal movement and my increased blood pressure, an urgent cesarean operation was performed. At the time of birth, Gunaisha didn't cry for a timestamp of almost 60 seconds and got admitted to NICU where she was on CPAP support for 4 days to monitor her heart rate. The immediate contact of the newborn and the mother is very important, but unluckily, I was deprived of experiencing this beautiful moment of my life. Later, things appeared to be going well till Gunaisha turned 6 months. Regular pediatrician visits were all fine till the time we came to know about her delayed milestones. The very first milestone in a newborn is head control that was lacking in our baby. Our pediatrician told us to wait till 7 months of her age, and by that time, I was giving her massage toys, thinking that this will help us to achieve her neck control. But when we failed to get what we wanted, we were suggested to visit a neurologist, and thus we met Delhi's best neurologist at her private clinic, where we were told to get an MRI done. As per the MRI reports and doctors' comments, we were informed that there is some injury in her brain due to which there is motor development delay. But this can be cured by regular physiotherapy and occupational sessions and avoiding massage. This was the first time when we came to know about cerebral palsy. Hence, without wasting a single day, we started Gunaisha's therapy sessions at doctor's clinic. I used to travel every day for a 30-minute of therapy session. The initial sessions were giving us a ray of hope that with some effort everything will turn normal and our baby will lead a normal life. But after few months and continuous consultations, when there was negligible improvement, the doctor revisited our case and said, if something has happened at the time of formation, that cannot be cured completely. This statement somehow took away our positive hope and surrounded us with numerous questions whether our child will be able to lead a normal life, whether she will be physically independent, will these therapy sessions be able to give results, will these tears be converted to smile someday, are we on the right path for our child's development? Despite of all these questions, we continued therapy sessions for her on daily basis without fail. To see a child crying continuously for an hour is the most miserable thing a mother could experience. But I was left with no choice. Gunaisha used to continuously look for me during her session, but I was helpless to give my baby to therapists whom I believed would make her independent. Within 1 year, Gunaisha was given different combination of all possible medicines. And in almost every 3 weeks, the doctor used to change her medicine, saying that those are for better muscle strength and tone. But on the contrary, it had an adverse effect on her emotionally and intellectually. Also, once the medicine stopped or changed, the attained improvement was also gone. As for example, she started saying Papa, but later forgot to say the same. Initially, she was an active child, but with vigorous travel and therapy sessions and maybe medicines, her sleeping pattern was heavily disturbed, and her neurologist gave pills to my 1 year old to make her sleep at night. Gunaisha used to get cold and cough frequently, and we were so scared to miss her therapy sessions that we used to give her medicine even on showing very few symptoms. We were suggested three different postures by her therapist to make her sit. But with all the three positions, Gunaisha's body was more inclined to right and made us so afraid about her posture that we actually stopped making her sit and were relying on medicines completely. Also, to avoid her inclined sitting posture, as there was no weight bearing on hands, we were suggested to go for an elbow support. when Gunaisha was already on an AFO for her feet. And later, we were told to have a neck support for her when her head holding was not as per expectations. But we denied to get all this external support for our child because we as parents have always dreamt of an independent child. And this is when we came to know about Vasa concept, where the journey is towards independence. Now with Vasa concept, Gunaisha is more happy and an active child. The puffiness on her face that was because of medicines is entirely gone. She has learned new words and has significantly improved intellectually. Now she says many meaningful words and make us understand what she wants. She is now more comfortable with exercises and at times take initiative to do it on her own. With Buddha sitting, her inclined sitting posture has also improved. Imagine that too without any external support. With Gunaisha doing exercises happily, even her grandparents are willingly helping her in daily exercises, which was not at all the case before. With Vasa concept, it has empowered us as parents and made us understand that cerebral palsy is not a permanent brain damage, but a temporary state which can be improved with hard work.
So that was the experience shared by mother of 2 year old girl Gunaisha. Now we will see a couple of videos of her before Vasa and after Vasa concept. So we can see the girl is crying and crying in this position when she was doing physiotherapy before Vasa concept. Yeah, this is again before Vasa concept. She is continuously trying in the all fours position, like dog position. She was not cooperating at all. Now see, with the Vasa concept, she is trying to come to top position by her own. She is playing so happily in the same duck position, duck sitting position. Playing with her father. She is maintaining the Buddha position so nicely. Now she has achieved great neck control with Vasa concept. And now we can see how easily she can coming on that monkey on rod position.